Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show. Yeah, and I think what you were mentioning before, where physical therapy and just educating the patient of like what they can do themselves to develop that resiliency and that self-efficacy. I think that's missing a lot of times when you look at specifically physical therapy. It seems that most patients just keep coming over and over and over to physical therapy, whereas the patients who, for some reason, anecdotally seem to be more successful are the ones that come maybe once or twice to like learn what they're going to do and then go from there. But when you look at physical therapy, especially in the United States, I don't know how it is in Canada specifically, but it just seems that there's like a one-stop shop where you just like, okay, you stretch this, you strengthen this. And it's not even like a very specific strengthening prescription where they're like, do RDLs because of this, like you mentioned, do some squats. They're just like, here's some baby exercises with some like pink or blue, like the small dumbbells.
Some banded external rotations with
exactly.
Yeah.
And then we'll see you next week. And then next week comes, we'll hit you with a little ice and then keep doing this and then on. So how do you think we came to this point if that's not really supported by evidence and it's not really successful or helpful to the patient?
Well, I think the first thing is that whenever we're talking about, like how did we get to where we are, especially coming from a standpoint like the three of us are from an evidence-based standpoint, the evidence-based movement's only been around for like 27 years or something like that. Like it's not a long duration. And especially that's evidence-based medicine, not evidence-based physical therapy. And so then evidence-based physical therapy has really not been around for long duration. If you start to look at most of the literature being utilized in the actual education system of physical therapists, it's not been a very long duration. And most people that are in physical therapy do not have a good comprehension of actually how to read research, how to find research, any of these kinds of things. And that inherently sets us up to be at a point where we are less likely to utilize it and more likely to go to things like post hoc fallacy and other forms of bias and limitations in critical reasoning to start to make decisions. Like if you meet most people that have pain, some sort of injury, if you give them enough time, they're going to get better. I think it's like 75 to 80% of musculoskeletal cases will clear up within 4 to 12 weeks if nothing is done. Nothing. And so then, you figure if the majority of people go and see a physical therapist and they do something, they're probably going to feel better in 4 to 12 weeks. And that will then make you believe that what you just did was good. And the most dangerous statement that you can ever hear from a long-term practitioner is that I've just always done it that way. And it's a very common story, and it's because they've seen success.
Because
there's
works,
so many problems with that. Exactly. It works. But then you have survivorship bias, and you have all these problems that come with practicing based just off of what you believe. And the challenge is, I think, that a lot of people struggle with reconciling that, where you tell them that the successes that they've had are not, number one, as good as what they think. Two, they've had a lot more failures than they realize. And also that a lot of what they do doesn't work by the way that they think it does, if it does work. Like if you've spent the last 15 years practicing as a primarily manual therapist in the field of physical therapy, and I tell you that, number one, most of your results are just due to placebo. Two, most of the results that are not due to placebo are due to contextual effects, like how you explain your intervention to the patient, and that they also have a drastic natural history occurring for them, and that essentially nothing more is occurring for you. Well, you're probably going to say, I don't know if I'm allowed to swear on here, but you're probably telling me to shut up and like stop talking about that. And possibly a lot meaner statements. And
especially if their financial situation is primarily based on them doing that modality, right?
Yeah, exactly. And that is unfortunately the case that I think we're heavily in my field, where the overall level of knowledge for critical reasoning, for reading research, all these things is relatively quite low, at least in my experience. I think that a lot of people in the field kind of have scraped by, so to speak, and been able to continue to provide treatments that have been relatively low efficacious and, low value care. And we've been in a medical system that is essentially looking to please patients, not necessarily provide patients with the best care. And we're starting to see that change in a lot of ways, primarily because I think payers don't want to just keep wasting money. And that's probably going to set up a lot of people to struggle in the coming future from different healthcare areas like physical therapy, because there's a lot of benefit that physical therapists can provide, but a lot haven't been doing it in the right ways.
Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.